So today, we're going to talk about heart failure. But this isn't just a clinical breakdown. We're going to dig into a really fascinating, kind of strange biological paradox that's right at the heart of it all.
And this is the big question, right? This is what we're going to explore. Because in heart failure, your body kicks into high gear. It triggers this massive emergency response. But, and this is the crazy part, that rescue mission, it's actually deeply, almost tragically flawed. All right, so to really get our heads around this paradox, we have to start with the basics. Get to the heart of the matter.
Yeah, pun intended.
At its most basic, heart failure is a plumbing problem, really. The pump, it's failing.
And that's really the long and short of it. The heart just can't move blood around the way it's supposed to. And this creates, two huge problems. First, your body's not getting enough of that good oxygen-rich blood. And second, all that blood starts to back up, kind of like a traffic jam, causing congestion, either in your lungs or, well, the rest of your body.
I love this analogy of a washing machine because it just perfectly explains that whole congestion thing. If the spin cycle is weak, water just starts pooling everywhere, right? And that's exactly what happens in the body. So to really understand why the pump fails, we need to talk about two really important concepts, preload and afterload.
Okay, so preload, you can just think of this as the fill-up stage. It's basically how much blood is loaded into the heart, stretching it out right before it gives that big squeeze. I mean, it makes sense, right? If you don't have any blood coming in, no preload, you've got nothing to pump out. Easy enough. But what about the force the heart has to push against?
Well, that's afterload. This is the pushing stage. Afterload is just a word for the resistance the heart feels when it tries to eject that blood out into the body. Think about it. If your blood vessels are tight, maybe from high blood pressure, that resistance is going to be high, and your heart has to work way, way harder to get the job done.
And this is such a great way to picture it. It really is like trying to squeeze water through a hose that someone is stepping on. The pressure right behind that pinch point goes way up, but the amount of water actually getting out, it goes way down. And that is exactly the situation for a struggling heart. It's working overtime for less and less result.
Okay, so let's recap. The pump is failing, and your body, it's not stupid. It knows something is wrong. It senses that drop in blood flow, and it hits the big red panic button, firing up these powerful ancient emergency systems. And this right here is where the story gets really interesting, where the paradox really kicks in.
So the body's first instinct is basically, whoa, pressure's dropping, we gotta crank it back up now. And it has two main ways of doing this. It activates your sympathetic nervous system, your fight or flight response, and it unleashes this super powerful hormonal system called the RAAS.
And this is that chain reaction in action. It all starts with the kidneys. They sense the low blood flow, and they shoot out a hormone called renin. That kicks off a process that creates this stuff called angiotensin II, which is a really, really powerful chemical. So what does it do? It tightens up your blood vessels and tells your body to hang on to salt and water. Now, from the body's perspective, this makes total sense. It's trying to raise the pressure. But what it's actually doing is just adding more fluid and more resistance, basically making the failing pump's job even harder.
And at the same time, the heart muscle itself is trying to adapt. Just like when you lift weights, a muscle under strain gets bigger. It hypertrophies. But here's the catch. This is not like building bigger biceps. When the heart wall gets thicker, it also gets stiffer. It becomes less flexible. And this process, called remodeling, actually makes it harder for the heart to fill up with blood in the first place, which of course just makes the whole problem worse.
So, you see what's happening here? It's this absolutely vicious cycle. The pump gets a little weaker, so the body tries to fix it. But the fix actually makes the heart work harder. That extra work damages the heart more, which makes the pump even weaker, which, you guessed it, makes the body try to fix it even more aggressively. It's a self-perpetuating downward spiral, and it's all fueled by the body's own good intentions.
Okay, so we've been talking a lot about the biology, the mechanics inside the body, but let's shift gears. What does this actually look and feel like for someone going through it? How does all this internal chaos, this fluid backup and low output, actually show up on the outside?
Well, there's a really great little acronym to help remember the common signs and its faces. So F is for fatigue. Makes sense, right? Your muscles just aren't getting enough oxygen. A is for activity limitation, for that exact same reason. C stands for congestion. That's the fluid backing up, often causing a cough. E is for edema, which is just a fancy word for swelling, as that fluid pools in your legs and ankles. And finally, S is for shortness of breath, which is one of the most classic symptoms, especially when you're trying to lie down.
Now, an interesting thing is that where all that fluid backs up really depends on which side of the heart is having the most trouble. So think of it this way. If the left side of the heart fails, it can't push blood out to the body. So where does the traffic jam happen? It backs up into the place it just came from, the lungs, and that's what causes all the breathing problems. But if the right side is failing, it can't get blood to the lungs properly. So the backup happens in the rest of the body's veins. That's when you see things like swelling in the legs and abdomen.
So this leads to the big question. If the body's own rescue mission is actually the problem, how on earth do you fix it? Well, this is where modern medicine gets really clever. The strategy isn't just about managing symptoms anymore. It's about strategically going in and interrupting the body's own flawed response.
And this is the absolute key takeaway. For a long time, the thinking was just make the heart pump harder. But now, the main goal is to stop that downward spiral by blocking the very systems that are causing it. The name of the game is to break that vicious cycle.
And how do we do that? Well, we have several really smart classes of medications, and each one is designed to hit a specific weak point in that flawed rescue plan.
This chart really lays it out beautifully. So is the body's fight or flight alarm system stuck in the on position? Okay, we use beta blockers to calm everything down. Is that hormonal RAAS cycle just going haywire? We use things like ACE inhibitors or ARBs to shut it down, which relaxes the blood vessels and helps get rid of fluid. And what about all that extra fluid that's already built up? Well, that's where diuretics or water pills come in, helping the kidneys flush it all out. See? Each one is like a countermove against the body's bad strategy.
But there's one other major player we should talk about, and it's a much older drug that works completely differently. It's called digoxin, and it actually comes from the foxglove plant. Now, digoxin doesn't really care about breaking that vicious cycle. Instead, it's something called a positive inotrope, which is just a sciencey way of saying it works directly on the heart muscle to make it squeeze harder. It boosts the force of every single pump. But, and this is a huge but, the big issue with digoxin is right there in that warning. It's incredibly effective, but it is notoriously difficult to dose correctly. The difference between a dose that helps and a dose that is literally toxic, it's razor thin. It's why it needs such careful, constant monitoring, because even a tiny mistake can be really, really dangerous.
So when you step back and look at it, the whole story of heart failure is really about good intentions gone horribly wrong. The body's survival kit, the one designed for short-term emergencies, just isn't equipped for a long-term chronic problem like a failing pump, and its attempts to help just end up making everything worse. It really leaves you with this fascinating final thought, doesn't it? What does it say about the complexity of our own biology when the best way to heal the body is to stop it from trying to save itself?